A 19-year-old woman is brought to the emergency room by a police officer. She was found wandering around her college campus, speaking loudly about her plans to become dean of the school. When the police officer tried to talk to her, she spoke rapidly and did not allow the officer time to reply. After reaching friends and family, both her mother and her roommates report that she has had no abnormal behavior in the past, but her roommates report that starting about 2 weeks ago, she began to stay up late at night, getting only around 2 to 3 hours of sleep. Which of the following is the most likely diagnosis? Choice A, borderline personality disorder. Choice B, schizotypal personality disorder. Choice C, brief psychotic disorder. Choice D, delusional disorder. Choice E, bipolar 1 disorder. Or choice F, bipolar 2 disorder. I'll wait 5 seconds and answer the question. So this woman is obviously undergoing a manic episode, which is more than 1 week with at least three of grandiosity, decreased sleep, excessive talking, racing thoughts, distractibility, increased focus on goal-oriented tasks, and excessive pleasurable activities. A single episode of mania without hypomanic, which would be more than 4 days of duration of similar symptoms without impaired function, or a depressive episode can be diagnosed as bipolar 1 disorder. So, choice E is the correct answer. Just as a quick note, her grandiose thinking, where she says she can become dean, that qualifies as psychosis, which actually can't occur in hypomania. So, just from that one point alone, you already know that this is a manic episode and not hypomania. So, looking at some of the other answer choices here, choice A, borderline personality disorder, this is just obviously wrong. Out of the personality disorder, personally, I feel like borderline personality disorder is probably the highest wheeled one. They really, really like testing on this one. Uh, People with BPD exhibit a pattern of unstable relationships with impulsivity and fear of abandonment. And what USMLE especially likes you to know about BPD is the splitting behavior, which is black and white thinking. So it might be something like a female patient, and it's almost always a female patient, has had several boyfriends and they go very hot and cold, which is they're really into their relationship at first, but then it becomes really sour, and then they end up saying, "Oh, all my previous boyfriends were really bad, but my current one really loves me." And another way they actually like doing it is by saying that the patient tells the doctor that they really trust him, but they really hate the nurse outside the room. Just really easy examples of splitting behavior. Choice B, schizotypal personality disorder. I just threw this one in here because sometimes the name throws some people off. Schizotypal personality disorder, some resources like to call it the Harry Potter types or whatever. They have magical, odd thinking or strange appearances. So they might dress very strange. They might say they have magic powers or something. And while this can put a strain on their personal relationships, they typically don't have manic symptoms or mood symptoms or anything like that. Choice C, brief psychotic disorder, also known as a brief psychotic break or a brief psychotic episode. This can be considered as such if you have at least one core symptom of schizophrenia, which is delusions, hallucinations, or disorganized speech and or behavior. So one of those symptoms for less than 1 month is considered a brief psychotic episode. And importantly, you need to be able to know the difference between brief psychotic disorder, schizophreniform, and schizophrenia, right? Like I said, brief psychotic disorder is less than 1 month. If you have 1 to 6 months, that's schizophreniform. If it's more than 6 months, that's schizophrenia. And just for a bit extra here, schizoaffective patients are patients who primarily have schizophrenia, but then they have episodes of depression or mania on top of that. Whereas bipolar with psychotic features, they mainly have bipolar disorder and then they have psychosis during their mania. So the names clue you in, right? Because it's called schizoaffective and it starts with schizo. So you know that schizophrenia is the main part and affective is the emotional part. Whereas bipolar with psychotic features, again, name starts with bipolar. So that's the main disorder. And then psychotic features means they have psychosis only during mania. Choice D, delusional disorder. It's pretty self explanatory. Patients with delusional disorder usually just have the delusions, but otherwise they function mostly normally. They're not going to have all the mood or sleep related symptoms like this patient has in a manic episode. And finally, we have choice F, bipolar 2 disorder. And as I mentioned, bipolar 1 just has one manic episode with or without a hypomanic or depressive episode. whereas bipolar 2 is the one with hypomania and a depressive episode. So bring it back, you just need to know what a manic episode looks like, really. And once you're past that, there's a lot of that annoying classification stuff. I would say, as far as bipolar disorder goes, the easy mistakes to make is not understanding the difference between one and two. Like I said, one just has the manic episode, two has the hypomania plus depressive episode. And you also need to know the difference between bipolar disorder with psychotic features, which is mainly bipolar disorder, and then they only have psychosis during the manic episodes, versus schizoaffective disorder, which is primarily schizophrenia, and then they will also have episodes of mania or depression on top of that. I hope you found this video helpful. I'll see you in the next one.